Hi. January 8th, last week, was one of my appointments to go see my oncologist. Actually, my appointment was with her physician's assistant. So, first thing I want to say is I got diagnosed in 2020, back when COVID was starting to hit the news. So this was one of the first appointments where I got to bring my husband with me, where he was masked and he wasn't working, and things just worked out schedule wise, where we were able to schedule the appointment where he could come with me. So that was really exciting for me. The first bit of this video is going to be, it's it's not as bad as it sounds, but sometimes because of the chemotherapy, they have trouble getting my blood work. And they need this blood work because this is my week off. They're just making sure that my lymphocytes are bouncing back. And, they're testing other things. It'll be explained a little bit later in the video. But anyway, this blood test I wanted to show that this particular nurse is actually doing really well. But sometimes there's a little bit of like jiggling around with the veins, or trying to get things started. I do tend to drink a lot of water, especially around this week, right before this week coming up and during the week. I try to make sure that I stay really, really hydrated so that they can get these blood work done in as few pricks as possible. 2-3 pricks is pretty normal. For them to get a blood draw. So this is kind of just showing that she is, the struggle is real. So, all right, that's the first part of it. Yeah, tons of water. So, yep. Okay. Is it? It's going to be hard on you now. Yeah, I shouldn't watch. Yeah. All right, so due to everybody else's privacy that's there, other patients, I didn't really videotape very much, like in the waiting room. But basically, you go for your appointment, you sit, and then they call you back for your blood work. Once that's done, they have you return to the waiting room where I returned to Jerry, and then waited for them to call me back to get my weight and my vitals, and then I wait for my physician's assistant. So what you're about to see is Krystal. If I seem a little bit like I'm rushing Krystal, it's not because I don't like Krystal. I love Krystal. She's one of my favorite physician assistants, and I see Krystal and Lindsay, they're wonderful people. And so anyway, this is her explaining some of the things to me. I'm asking her to go back in my older files to be able to explain some of the things that they're testing for and what I've been through. And she was really nice enough to do that, but I'm not rushing her. I'm just trying not to take up too much of her time because I know they're incredibly busy. So this is Krystal explaining some of my health care and what I've gone through so far. Oh, this is Krystal, and this is just for my TikTok. This is Krystal. She's my physician's assistant, and she's amazing. And so we're here to get my blood scans, and just basically before I get my Lupron shot to make sure that everything's normal. So, how are we doing?
Everything is looking good so far. There's a little delay in the lab on the kidney and liver function test.
Okay.
But your blood count looks excellent.
Great.
Your immune system is good and strong like always. And you're not anemic, and the platelets or blood clotting cells are normal. So
great.
The basic stuff looks good. Blood pressure looks fine. How are you doing on the pills that you're taking?
Great. Everything's going well so far. No complaints.
Are you currently finishing up your off week or your off?
Yep, I'm off
cycle?
Right now,
okay.
So I'll be starting again on Saturday.
Saturday is your start
Is
date,
when I start the Ibrance again, yeah.
Okay.
So, all right. So I was going to ask you a little bit about my case.
Okay.
Just from memory, how big was my tumor? My main tumor, it was on the left side, and it's I think it was satelliting around some of the lymph nodes, stuff like that.
So your original mammogram was in January of 2020. Does that sound right?
Yes.
And they could see upper outer breast.
4.2 centimeter. Okay.
And they also saw a left axillary or under the arm lymph node that was enlarged as well at 1.6 centimeters.
Okay, cool.
That was based on the mammogram.
Okay, great. And the surgery that I had, the lung surgery, I need to do some research on it before I describe it to people. But do you know what that was called? They did a lung surgery to diagnose the nodules in my lungs.
It was called a wedge resection.
A wedge resection. Thank you.
The bottom line target goal with that procedure was to get a piece of the abnormal tissue to be able to do a pathology test on it to confirm if it was cancer or not.
Great. Okay.
Which we did.
Which it did. Yeah.
Yes.
Okay. And then you had mentioned some time ago that I could get my scans on a DVD.
Yes.
Yes.
Well, I mean, it might be like a CD. I'm
okay.
not sure what it is.
Yeah, something like I could just like get the scans.
I think there's a form you fill out and then we mail it to you.
Okay, great. And then, okay, so then also I had questions about getting the vaccine. Like, do you think I should get another vaccine for the summer for COVID? And then also this monkeypox thing.
Okay. You've had 3 COVID vaccines?
Yeah.
So you're due for a booster.
Okay.
Dr. Schmidt does recommend it. Your immune system has been wonderful. Most of the time on Ibrance, we do see a drop in the immune system, and thankfully yours hasn't been significantly impacted so far.
Great.
But you're still on like systemic cancer therapy, so we do still put you in an immunocompromised state.
Great.
So you qualify and would be recommended to have the booster, and my scheduler can set that up before we're done today if you want.
Cool. Thank you. Mm-hmm. Yeah, I would love that. And then this monkeypox thing, they say that smallpox vaccine works on monkeypox, but I don't think I got the smallpox vaccine. I was born in like 72, I think.
Like, I mean, we'll have to do a little bit of digging, but I don't have any changes to our current protocols for vaccinations for that. At this point, I don't think it's...
I don't even know if it's a danger in the area right now.
It's a big enough threat in our area, so we're not changing our...
Okay, nothing new. Mm-hmm. Okay. Okay, great. Thank you so much. I appreciate it. Welcome. So once I'm done with Krystal, then I return to the waiting room and, well, a different waiting room. And then they call me back where the nurse gives me an injection of Lupron, which is another drug that's meant to stop my body from producing any estrogen, because that's what my cancer basically feeds on, is estrogen. So anyway, that's kind of what an average appointment is like for me. And I go once a month, so about every 4 weeks to the appointment. And then this month, in a few months from now, this summer, I'll be getting another PET scan so that you can see. And also I'm kind of excited because I'll also be looking into getting a CD with all of my different imaging on it, so that I'll be able to put some PET scans and maybe my mammogram and so forth. I have to talk to the lady about which images I wanted. And then also maybe in the near future I can talk about some other things like the surgery that I had. I don't know what people are interested. If you have any suggestions for videos, please feel free to leave them in the comments below. If you have questions or comments or anything like that, that's what the comment section below is for on YouTube. So feel free to utilize that if you want. If you got here via my Facebook page, you can leave messages for me there. That's mainly just for family and friends, though. It's not really made a public thing. So anyway, My other thing is that I should be making another video sometime soon about my chemo cycle. So I'll try to do some of those things in the coming weeks. Bear with me, I'm still learning how to edit videos. I'm still using my headset for a microphone. So, thanks for listening. And if you are interested in getting updates, please feel free to subscribe. Thanks. Have a great day and be kind to yourself and others. Bye.